Hi there.
Hi, can you hear me, Shannon?
Yes, ma'am, I certainly can.
All right, sorry about that delay. I'm just gonna hand it over to you.
Hey, I need to make one of my folks the moderator.
Fantastic. And just so you know, we are now recording.
Okay, cool. So let me find Kristen Duffy is my moderator.
Fantastic. Oh, I love the colors on your slide.
Where'd they go? I need to get this whole thing. Folks, could you make sure to mute your microphones for me so we can all hear what's being said about me at first, because it's all about me for the minute. So, hi, everyone. I'm going to give this another minute before we start. I'm trying to put this in the actual window of my computer. It's not doing what I need it to do. Okay, so hi. I'm Shannon McCleary Hooper. I'm the Peer Policy and Planning Specialist, which basically translates to Program Manager for our peer support programs here in Riverside County. Riverside University Health System Behavioral Health is the name of our agency, and we are probably the largest peer workforce that is in the state of California and pretty much the United States outside of the Veterans Administration. And so I'm coming to you today to kind of talk about credentialing your lived experience and to support supervisors and the peer support practice in your I'm trying to get this thing to give me my PowerPoint. Not doing it. Hold on a second. I gotta find. I don't know why it's not doing that. I can't see it. I can see it on my screen, but I can't see it up there. Let me see. I'm gonna hit escape and see if this goes. Okay. Screen share. Let's do this. I'm so sorry, you guys. There we go. So when we credential our lived experience, it's actually kind of important that we talk about ourselves as peers, right? So I'm a peer, I'm a person with lived experience, and this is me. That's me. That's me about 30 pounds ago, but that's me. And I'm a wife and a best friend to my spouse. He's pretty much my best friend, and yes, we have matching teeth. I'm a daughter to, no, that's not Frank Gallagher from Shameless. That is my father, David McCleary, and my mother, Gloria. And I am the mother of two awesome kids. That's my daughter, Devin, on top. And at the time, that was my son, Andrew. But now my son, Andrew, is now my daughter, Amber. She is in transition. I'm a mama bear. I'm an ally and a member of the LGBTQ community, and I'm very, very proud of my kid. I'm also the sister and caregiver of a person with Matt Bailey boy. He is prince of all things that are furry. And one of my very best friends in the whole wide world is Jeffrey Cadwell, and he has MS, and he is in stage 4 of his MS, and he lives in a long-term care facility in Orange, California, where I live. I'm an old surfer. I worked as a lifeguard right out of high school, and so the beach is kind of where I find my center. So I kind of think it's important that you know maybe that part about me. I've been an actress all my life. I started acting when I was 9 years old, and I've been performing professionally for over 3 years. I'm also a costume designer, a costume that I developed there. That's Endora from Bewitched. For all of you guys who don't know what Bewitched is, look it up on the interwebs. It's a great show. It's a sitcom from the 70s. And I'm a cosplayer and a makeup artist. These are things that I do that kind of make me me. I'm also obsessed with the Wienermobile. I am a musical theater fanatic. I absolutely smile every time I see a Volkswagen Bug or a Beetle. I really feel that Wonder Woman influenced my positive sense of self as a kid in the 70s, and Linda Carter rocks. And Judy Garland is kind of, I don't know, how I see God. And I'm going to be the next chapter. So you all know that. So, my lived experience. My lived experience is that I was diagnosed really young. As a little kid, I had a hyperactivity disorder. I was one of the Ritalin kids of the 70s, and I already knew that there was something different about me. When I was in college, I was working as a theater major, and I was performing a lot, and I was learning all these different parts, and I discovered that I was losing time. And I had been doing that since I was a little kid, but it didn't actually really show its face in my life until I was in college. And when I was divorced, I was married very briefly, like for a hiccup. I got married the first time. I was very young. And I fell into a very deep depression, and I was living in my car. And I come to this work because of that lived experience. And you know, my mom has mental health challenges, and she openly shares them. And so I kind of come from that angle as well. When I tell you that I work for the peer, and I advocate for the peer, and I advocate for the peer role in service systems, I speak in terms of that space, because I'm the person with lived experience. Okay, so is my audio still cutting out, guys? I'm sorry if it is. I'm getting closer. So when we hire people in Riverside County, we have a definition of what a peer support specialist really is. So we're not just hiring a warm body. We're not hiring just some person who says they have experience with having meds, or maybe had experience with some symptoms or whatever that is. A peer support specialist is definitely a person with lived experience. They are people who live in wellness and recovery. People who can model wellness for other people, people who share their story in a meaningful way, people who have trained in the practice of peer support. And I call that being credentialed in peer support. Our credentials are, our experience is our credentials. So that's what makes us different from other people who are credentialed to provide services from the licensure standpoint, or from people who are indoctrinated into a practice. Peer support specialists are indoctrinated in their own practice, and we are bound in Riverside County to follow the SAMHSA guidelines for peer support. And I know that a couple of the other presenters have shared those with you. I have them, and I share them with everybody that gets to know me about the work that we do. These core competencies are available on the SAMHSA website, so just making sure that you know about that. Peer support workers, they engage in a wide range of activities, and those activities include sharing resources and building skills and building community and building relationships, leading recovery groups, making sure that they're mentoring and helping people find goals that they want to set for themselves, and walking side by side to get those goals in line with their plans for recovery. They support the roles of providing services and trainings to staff. They develop the resources. If we don't have a resource, we go and find it and create an avenue through which a person can actually utilize that resource. And really, our peer support specialists actually inform our policy makers in the county of Riverside, because they're everywhere. They're in every single program and service we have in Riverside County. Our history of peer support in Riverside County was instigated by the California Mental Health Services Act of 2004, and that's that 1% tax on millionaires. That specialty mental health service is peer support. And our early peer support started with just the parent partners, which are parents of minor children who are working through the challenges with their children through different avenues of resource, with public social services, with behavioral health, with the public health administration. So they are keyed into minor services. We also had family advocates who support adults living with behavioral health, folks who are working with an adult, either adult child or with a spouse or partner or a friend or somebody that they support full time. And they speak from that sense of lived experience in peer support. So those were the two peer support roles we had in Riverside County first. The consumer peer support came a lot later. We acted on this MHSA law and had our very first pre-employment training course for consumer peers in 2006. And they were, the first class we had was, I want to say there were 17 graduates, and we hired like 9 people from that graduating class, 7 to 9 people that were hired from that first class. And I'm not part of that first class. I think we only have 1 or 2 people from that first class that are still working with us right now. And our administration wanted the peers to be, they wanted them to be champions for the system, to change the way the system operated as a medical service clinical practice to a more integrated service provision team sort of format. And we were very lucky because we had advocacy right at the top when we started. So what have we learned? Well, I've been in Riverside County since 2007 as a peer provider. And so, and I became a manager in 2013. So I've been on this ride for a long time. And we've learned a lot of things that we've done wrong, things that we didn't know then that we do know now. And I kind of want to share those things with you. One of the things that we focus on is that we hire for the wellness. A lot of times in the past, we had hired folks because they had a diagnosis, and supervisors didn't know any different. They just thought, if you have a diagnosis, we can put you to work in the clinic if you think that you can do A, B, and C. And we realized that that's just not, it's not as effective in our public health service agency. We have to be well, we can't give away what we don't have. And so we now really focus on, when we hire somebody, to recognize that they know the person. I know as the peer provider, I know that I know my wellness, and I know when I'm not well, and I know how to manage that for myself, and I know how to self-regulate, or I know how to take cues from others when I'm not doing well. We also learned that we need to recognize specific lived experiences when we place somebody. So if we have a program that is substance abuse focused, substance use disorders focused, we want to hire somebody who has lived experience in substance use recovery. It makes no sense to have somebody who has no clue what that looks like, has never been raised in it, doesn't know what that looks like, to hire somebody for that purpose. We've also learned that we need to create other avenues for peers to try it on for size. So we have a very robust volunteer program, a very robust internship program that is limited to 6 months. It's a 6-month, very structured training and rotation, where they go into the clinics, they work full-time, but they work part-time for a committed 20 hours per week for 6 months, and they get on-the-job training while they're there. So they don't have to jump into a full-time gig the first time they jump into peer support. So that was another thing we learned. And then we created career pathways for the role. So if you're a person who is in recovery, you're working in our clinics, you're working in some of our contract service provision avenues, and you're finding recovery and you want to share that with another person, we want to create a pathway for you to get to paid employment. And we have done that. We have structure around that. We also manualized our training standards. Our training standards, there is a peer support manual. There's a volunteer handbook. There is a senior peer support manual, and I'll talk about the senior peer support role in just a minute. And then what we learned is that we had to train the supervisors. when I started as a peer support specialist, I was assigned to this little cottage clinic in Banning. And Banning, California is like, I don't know, a bump in the road. It's this little place about 40 miles from Palm Springs. And if you blink, you'll miss it. And so it's a very isolated place. At the time, and the training had stopped with the peer support certification training. There was nothing else in place for a peer. So we knew that we had to address that for the supervisors, because the supervisors were like, I don't know what to do with this guy. So we addressed that. So that's another thing we learned. And then the last and kind of the most important thing I want to drive to you guys today, and I think we talked about this last year at the conference, which was we need to frame peer support as a practice. A doctor is indoctrinated with stacks and stacks of books and years of education that indoctrinates him or her or them to their language that they speak and the way they deliver information to a patient. A nurse is indoctrinated to her terminology or his terminology or their terminology or their practices around how they administer medication or advice or take vital signs. As a therapist has their own practice guidelines. There are practice guidelines for every discipline, and that is something that peer support specialists, I think, sometimes forget to recognize. So those were some of the biggest things we've learned over the last, where are we? This is 2020. So since 2006, for the last 14 years, these are the things we've learned. So where do we utilize peers in Riverside? We utilize them in every single program. Our mature adults, our adult outpatient stuff, our drop-in centers, our juvenile justice, our new life, AB 109 justice-involved folks, long-term care, crisis outreach teams. There's a peer on every team. We have a navigation center here. We have the commercially sexually exploited youth. We have a program specific that has folks with that lived experience. We have family room clinics, integrated centers, workforce trainings. We do research and technology. We have a senior peer in our research and technology department that helps us to collect research, but is the peer voice at the table when we collect research. And then, of course, conferences like this one that you guys are participating in. Are there any burning questions that you have before I move forward? I've got a moderator here, Kristen Duffy, who, if you can see her face, that's Kristen. Say hi, Kristen. Kristen is going to be answering the questions as we go along. Anything come up, Kristen, if you unmute yourself, anything to address?
Well, with the way you have your screen shared, we can only see your entire presentation. We see the little box up at the corner, at least my view is the little box at the corner and your presentation. So questions, the notes in the chats were just please, everybody please mute. And now Dylan is coming through, that's what he sees as well.
Okay, can you see this, the group chat up here?
You just need to make it full screen.
Is that what I've messed up here? I'm trying to see where to find that. Where do I find that? More. Record, hide, disable, share computer. Where's the full screen thing?
Maybe display settings there.
I don't know. Oh, display settings?
Yeah. And run it as a presentation.
Can you guys see that?
Yes, that's better.
Is that better? Okay. Can you see the questions that people are asking, if they're asking any?
So far, nobody's asked a question.
Okay, cool. I don't know why this is doing this. Let me. Huh, it's very odd. I don't know why this is happening.
I see the slides as well as the videos of other members.
You can? Okay.
I do, yes. Okay. I'm not sure.
That's weird. It just looks different here, and maybe it's our firewall in Riverside, because
maybe
like okay. Fort Knox here, so sometimes we get everything that everybody else gets.
Thank you.
Okay, thanks so much for that. So you guys, so the roles in the peer support specialist roles in clinics it really is to be the evidence that recovery is actually possible. You know, they tell us that when we get trained in peer support, when we get certified, they tell us ITE, right? I am the evidence. We got to role model that in our clinics, and we role model that not only for the people that we serve, but for our coworkers, the people who are not peers, the people who don't self-identify. We facilitate groups. We even come up with our own peer support groups. If we have a creative idea, we bring it forth and try to share those ideas with the people that we serve, and training opportunities for people who are new or have never been exposed to peer support. We support consumers to learn new ways to wellness in groups and in one-on-one settings. So we do one-on-one, we do over the phone, we do it in a group, we facilitate, we co-facilitate with other clinicians if they're doing a clinical practice. So there are tons of groups that we do here in Riverside. We provide training for staff to remain hopeful. And I think it's funny that for a while we had to replace the word recovery with hopeful. Recovery became kind of a bad word. And I don't know why that is. It was some kind of cultural shift we were experiencing, some kind of growing pain we were going through in Riverside. And so we exchanged the word recovery for hopeful for a little while, and it helped to engage people who were not hip to the idea of having consumers work in clinics as much as some others. So it kind of helped that transition for us. So that's also another little thing that we learned that might be helpful.
And we do have a question.
Okay.
How do we prepare clinical staff to embrace peer workers? This is from Liz.
Okay, so Liz, thank you so much for asking that, because I think that we have to steer away from us versus them sort of thinking. I think that's the thing that moved us forward. I think Kristen would agree with that. When I talk about moving you to the next level of integration into your system, is creating an atmosphere where we are sharing the learning and we are holding compassion both ways. So oftentimes I hear peers, they'll come to me and say, my supervisor doesn't get me. My supervisor doesn't understand, and they don't understand, and they don't get it, and they don't know what my role is, and they, and us, and not about us without us. And I'm all about not about us without us, okay? I'm the first one to chant that at any rally you want to have. But when you are trying to integrate your system, it's important to put on your compassion goggles for that supervisor, for that clinician, for that staff member who's not buying in yet, because their story isn't over yet. They don't know yet. They haven't learned enough, and you have to be the one that says, hey, I don't know yet, and I don't know what your role is, so I can learn alongside you. And I'm happy to here to share my role with you, and you can learn with me. So I want to make sure that when we're talking about influencing recovery and hope for your system, we're not talking about us and them. We're talking about all of us. We're in this together. We're all here for the same reason, to be there for the person that we're serving that's walking in off the street that needs the support. Did I answer your question?
I also added into the comments that we peer support everyone, including the clinical supervisors.
Right. We peer support everybody. And so I have a role in our system that's the senior peer support specialist that I'm going to get into in just a second. So I might be able to answer more of this as I move along. Okay. So we create and model a recovery environment, and I'm going to share that grid with you guys in a minute about what a recovery environment looks like to me. And then we allow the person to take the lead. The person we're serving is taking the lead. We're not being punitive with the person we're serving. We're not giving direction to the person we're serving. We're asking them, what's your goal? Where do you want to go? How do you want to be? How do you want to feel? What do you want your life to look like? And we follow them to that by breaking it down into small, chewable bites. So one of the questions I ask supervisors when I give this training, I do a training for supervisors here in Riverside called the Supervisor's Guide to Peer Support. And one of the questions I ask them is, what do you find most challenging? And some of the things, and I have a list that were identified in my training, I want to share with you guys, because these are the things they shared with me that I think might be helpful for you as you move forward in trying to become more peer-centric about how you supervise. Supervision to me is a universal thing. I think that supervisors could have better relationships with the people that work for them if they practiced peer support with their staff. And I think you've heard that as a theme going through this whole conference. And it's something that, that I address when I train supervisors. And so when I talk about this with them, they say, we have to talk about the boundaries as they pertain to the employee and the employer in terms of standards for HR. So each HR has their own standards of what the employee and the employer's roles are in the clinics. Just because we have a job class that says that we self-disclose about our personal lived experience doesn't make us any different than any other employee. And I'm going to say that again. Just because we have diagnosable personal lived experience that we divulge to the people that we serve and to our coworkers, it doesn't mean that we get treated any differently than any other staff member. ADA, the ADA, the FMLA, all the things that every employee gets advantages to deal with wellness challenges, no matter what they look like, are dealt with the same by law. So I don't know that we need to be treating people with kid gloves. I think that if we train supervisors to have I statement conversations with their employees, that they're better equipped to be able to provide the equal amount of support for each person that they are serving as employees. We also have a job classification that's very specific in Riverside County. It's our job classification, and you can get these from me. I'll email them to you if you want them. But the job classification we have the support in place in Riverside County with my department, which is Consumer Affairs. Consumer Affairs is a sub-unit within our behavioral health system that provides support to employees who are struggling on the job, and specifically peer support employees who are consumer peer support employees, because I provide all the oversight there is about their job role, their job functions, their job duties. And if they're having challenges, they can pick up the phone and call me, or call my employees. My direct reports are all senior peer support specialists, and I have 17 of those in my services. And I'm going to talk about in a minute. Disciplinary action and how we separate a person's professional behavior and the performance from pathology. Okay, so that was something that the supervisors brought up. Like, a lot of supervisors that work in behavioral health, they're clinicians. They're people who are marriage and family therapists, and they're great at that. They're great at being therapists. They're great at social work and recognizing when somebody's having challenges. That's their strength. But the problem is pathologizing an employee is actually not legal. We're not allowed to pathologize an employee. I'm not allowed to talk about your condition, if you will. I can't talk about your diagnosis or talk about that your diagnosis is getting in the way of whatever work you're doing, right? I can't really get into that as your employer or supervisor. But what I can do are A, B, and C. And I have to be able to delineate what those expectations are on the job. And that's professional boundaries that we hold with the people that we're working with. So I always encourage clinic supervisors to create a list of expectations. If they don't know what they should be, to work with me to come up with what those are. And I help them to define what those expectations are. And when the person isn't meeting those expectations, then that reflects upon the person in their evaluation. And we use it as a coaching opportunity for a person to learn more about how they can most maximize their time at work and how they can be more productive, and how they can affect change for their own agency. And then there's also this concept of youth and how young people, when we put young people to work as peers, we want them to be the voice of recovery for young people. We have a robust TAE program in Riverside. And we have to think in terms of a youth discovery zone. Like, what are they learning about themselves? Because they don't really know much about recovery, right? Because they're new. And so we have to think in terms of what are they discovering about themselves that's going to actually lift them into higher levels of leadership to role model their own discovery, recovery function at the site where they're working, and how they inspire others in the work that they do. There's a correlation between early onset psychosis for young people and the cognition that a young person has at an early age, and how it affects a person when they're older. So I talk to supervisors a lot about how over and over again every day, then that's something that you can address from maybe a learning challenge, or maybe something that you can get counsel with if you don't know how to do that, from maybe a person who's an educator. I have the benefit of, I was a school teacher before I came to the county, so I have the benefit of that knowledge, so I can sometimes counsel a supervisor in that process with an employee that may be struggling. So if you guys have challenges as supervisors yourself, or supervisors that are having challenges, I'm going to encourage you to email me offline here, and you guys can email me or send me a message, and I'm happy to address those challenges with you one-on-one. I provide mentorship and coaching for people one-on-one all the time. So, and I'm a county employee, so I can do it on the clock, so you can contact me anytime about those challenges. We have our support circles, we have our social media support circles, we have practices that we put in place for ourselves, but we try to influence the system to support wellness at work universally. So Riverside County has a thing called the Culture of Health, and they send us an email every week or every other week about a wellness practice, and then we also offer WRAP to every single behavioral health employee. My division actually provides the personal WRAP workshop, and then we also provide the WRAP facilitation workshop, because we have advanced level facilitators here in Riverside. So all the WRAP activities are sponsored by my office, which helps people kind of reach into my life, and I get to know them so that I can help influence their own wellness at work. And right now, with what we're dealing with the COVID-19, man, my phone has been blowing up more than I think I've ever experienced in my entire career. I get Skype messages all the time, and texting, and people calling right now because of the stress that they're under. The wellness at work has been like the biggest thing. And for some people who have been taken out of their routines and having to do what we're doing today, and stepping way outside of our own comfort zones to do this stuff, I'm currently way outside of my comfort zone by doing this with you guys today. And I'm really like, yay me, because I'm able to get through this without completely falling apart. But what I say to all staff is that you can't give away what you don't have. Kristen said it today, and somebody else had posted it. You can't pour from an empty cup. And somebody said it to me at one other time, is that, like they say in the airplane, when the flight attendant tells you, put on your mask, secure your mask before you help another person to secure their mask, it's the same thing. We have to do that in peer support and look after ourselves. When we added the layer of the senior peer support specialist in our work flow, in our career ladder, it was a huge game changer. So I'm going to move to the career ladder. Our lived experience career ladder in Riverside is very specific. It starts with the peer support specialist, family advocate, parent partner, volunteer, and then the peer support specialist, family advocate, parent partner, intern. As I said, the internship is a structured internship, 6 months, 20 hours a week. You get one-on-one supervision with a senior peer support specialist, and then in clinic, on-the-job training of our manualized training that we do here in Riverside. And then the next level is our trainee level. That's kind of where everybody enters our system. If you are hired full-time for the county, you're hired in as a trainee. Right now, our trainees start at $14.95 an hour. That's the current rate that they get per hour to start without any experience as a peer support specialist. And you do not have to be a volunteer or an intern to become a trainee. So I wanted to be clear about that. If the job is posted on our website for a trainee, anybody can apply for it if they have lived experience. Once you work in our system for a year and you've met criteria to move on to the journeyman level, you can be promoted to the journey level if you have 365 days of full-time service as a peer support specialist working for our county agency or for an agency that embraces the peer support model where the peer support specialist is utilizing like to promote from within because they know our system and they know our employees. They have an association with the people that we're working with and the supervisors. And but it's not a requirement, but it's something that we look for. And the senior peer support specialist has got a very defined role, and they also have a job class in our system. They senior peer support specialists, when they're promoted, they automatically go to, let's see, their pay range is I find myself in a place where I want to do something else in the county system and I'm qualified to do so, the sky's the limit for me. And I try to think that way for anybody that works in our system. So let's talk about the senior peer support team. The senior peer support team is leadership with lived experience. We found that having the senior peer support specialist is really necessary in helping a peer support specialist stay the course to and even work with the peer in a way that the supervisor cannot work with the peer based on personal lived experience, shared personal lived experience, and having that peer-to-peer relationship that isn't punitive. So their leadership with lived experience, they're placed regionally in our system. Riverside County is the size of the state of New Jersey, basically. We have 2.4 million people that live in Riverside, and we have an expanse of 750 square miles, or radial miles, not square miles, radial miles. So it's a huge expansive space. So we have people that are placed in the desert, people who are placed in the Temecula wine country, which is our mid-county region, and then in downtown Riverside. I say I like a minimum of 2 years experience as a line staff peer support specialist who has provided documentation, who understands the billing processes, who can train another person on how to utilize our electronic records. Their role, though, is only that of mentorship. They're a trainer to the line staff peer support specialist. They are the mentor. They are the person that they can bounce ideas off of. If they have difficulties in the clinic, they can actually have a conversation with the senior, and the senior supports their process in getting back to work. Because a lot of us they are also the senior peer. The role that I think is probably one of the most important roles of the senior peer is that they are the clinic supervisor's partner. They have a shared voice with the supervisor. So they're there to support the supervisor and the peer. Side of being there for the supervisor, providing support, lending them an ear, and telling the supervisor, hey, I have no punitive role with this peer support specialist. I'm not going to write them up. I'm going to support them after you have to write them up, because if you do have to write them up, so be it, because that's not my responsibility. My responsibility is to make sure that I'm giving the peer every bit of support that they need to be able to rise to the abilities that they're expected on the job to be able to get the work done. Now, this looks really different in a nonprofit scenario. We work in a public service agency. There are productivity benchmarks that we have to reach here. And sometimes we find that peer support specialists come to work for us and they realize, this isn't what I signed up for. This isn't what I want to do. I would rather just support people. And we find them opportunities to work for other nonprofit agencies where they're not expected to document. They're not expected to use our electronic record, or they don't have to report to work for a 9 or a 10-hour shift. In Riverside County, we do 9 and 10-hour shifts, and sometimes that's rough. So the senior peer support specialist helps that person explore that and how they reach the goals that they want to reach in their own peer support practice. Support specialists, role model for line staff. So they got to be pros. They have to be professional. They have to be able to recognize their own sense of wellness. And if their wellness is compromised, to be able to give and receive feedback from me or from a supervisor or from another administrator that might be managing that program and noticing that maybe the senior's not doing so well, they need to be able to receive that information, process that information, and come back and say, yeah, you know, I'm going to do some self-care and stay home today. And we have sick days that we get in Riverside County, so we can go home and care for ourselves and come back with a full cup to pour. So that's kind of something I wanted to make sure that you guys understood. There's a difference between the senior peer support role, because the senior peer support role is focused around the core competencies of peer support from SAMHSA, and the supervisor's role is that of what HR has assigned to them and what their license requires of them to complete day to day in the clinic to serve the people of the public. So the high expectation. And that's hard sometimes. That's hard when we're talking about public health and public behavioral health, well, where we move really fast and we see a lot of people in one day and we get burned out. And sometimes we lose